हेलो एवरीवन, अस्सलाम वालेकुम। मैं फरहान ताहिर, आपका क्लास फेलो। आज मुझे ज्वाइन कर रही हैं हमारी क्लास फेलो गजाला नागरा, जो कि इन्फेक्शन डिजीज स्पेशलिस्ट हैं। आजकल टेक्सास में डैलस के करीब रहती हैं। गजाला, थैंक यू सो मच फॉर टेकिंग द टाइम टू ज्वाइन मी।
Thank you so much, Farhan, for inviting me, and I'm so glad to be reconnected with सारे class fellows के साथ after at least 20 years.
आई नो गजाला, जब हमने कोविड 19 के साथ आइसोलेशन शुरू हुई तो फरहान सिद्दीक ने ये व्हाट्सएप शुरू किया और वी हैव सिंस देन बिकम सो क्लोज। जो ट्रू फ्रेंडशिप्स होती हैं उनके लिए ड्यूरेशन ऑफ टाइम इज नॉट एज इम्पोर्टेंट। यू कैन रीस्टार्ट वेयर यू लेफ्ट राइट अवे। सो आई एम ब्लेस्ड टू हैव फ्रेंड्स लाइक यू। थैंक यू फॉर टेकिंग द टाइम।
Thank you so much.
तो जैसे आपको पता है कि पैटर्न हमारे इंटरव्यूज का ऐसे है, वी आर टॉकिंग अबाउट प्रोफेशनल लाइफ्स बिकॉज आप यू आर एन इंस्पिरेशन फॉर नॉट ओनली अस बट generations to come. हमारी we are all in our midlife now and हमारी new generation already schools में है. So I want to highlight people like you who are exemplary and inspiring for a lot many other people, and you have had an interesting life story. So to begin with that, हमारा usual question जो RMC के सारे students के साथ है कि what made you decide to become a doctor?
Yes. So, Farhan, thank you so much for saying so much good stuff about me. I'm humbled. Thank you so much. So, my answer is not any different than rest of the class fellows. So, हमारे parents होते हैं जो driving force होते हैं majority of cases. In my case, my dad was the driving force. So, he wanted somebody from his family to be a physician. So actually, I was honored to fulfill his dream. So that's how I became a physician.
Mashallah. And tell us a little bit about your school. Were you a Rawalpindian or Islamabadian? And how did you decide to RMC? Okay.
Yeah, so I'm Rawalpindian, very close to, RMC.
RMC, okay.
I got matched in King Edward Medical College. But then because it was very close, RMC was very close to my house. So I'm like, it's very convenient. So
yeah. So RMC की कोई यादें आपको हैं ज़हन में? कोई what was your feeling about RMC? कैसा आपको लगा उधर अपना 5 years?
RMC, whenever I thought about RMC, it's always give me, very pleasant feeling and moment of happiness and joy. Very good friendship. We were 4 different friends. Shaila Bilal these days. Sobia Tahir, she's in Australia. Or Shabab is in Seattle.
Okay, but आपने you have given me some more ideas to reach them out. So आप मुझे ये बताएं कि medical school जब खत्म हुआ उसके बाद आपने क्या किया?
So medical school के बाद I did 6 months rotation in GYN, OBGYN, Holy Family Hospital, and Mehwish Manaz was with me at that time, and it was a big torture, like 36 hours non-stop without any sleep or food. And I still think about that OBGYN rotation. I have goosebumps. I don't want to do ever the rotation.
I will do that rotation. So 6 months of that. What else did you do?
I did 6 months of internal medicine, RGH, and then I got married and I came to US.
Acha, so what year was it when you came to United States?
Around 2000.
Okay, and then you got on to start your journey to start your internal medicine residence?
Yes, so there's an interesting part in between. So
okay.
I came here. My husband was 1 year old when he moved to US, so he was well established and working. And I came here and I was so relaxed because my story is different than you guys. As a boy, you have to come and establish yourself, and I was already established with my husband. So I'm like, I don't do anything. Sit back and relax. And I was just waking up at 12 noon and making my food, going out window shopping, and absolutely no plan for studying. no plan. And then what happened? I was just visiting my in-laws. I was in New Jersey, and my in-laws were in Langhorne, Pennsylvania. You're familiar with that
Oh,
area?
I'm very close to that area. Yeah.
Yes, we were seeing them once a week. Over one weekend, I met Harun's grandfather, and he's like, "Beta ji, what do you do all day?" I said, "Oh, I do a lot of things." He said, I'm like, I wake up, I cook my own food, I watch TV channels, cooking shows, and I go out and we dine out. And life is fun. And there was a beautiful lake in front of my house, and I told him there's so beautiful ducks and ducklings. And he's like, okay, seems like Betaji, you do everything which is not important.
Oh my gosh. That's very typical of our Pakistani people,
Yeah,
right? Yeah.
Pakistani people. It
Yeah.
kind of reached my heart.
High
I'm like,
achievers.
why he's interfering in my personal life? So I shared with my husband, and he's like, listen to everybody, do whatever you think is right. I'm like, oh, okay. Then I sat back and relaxed. I'm like, oh, he's a very good husband. He's not pushing me. Just enjoy more life. Anyhow, then this 9/11 happened. I was back home back then and visiting my parents, and then I got stuck there for several months. And fast forward, I came here, and my parents were visiting me, and then again, my dad. Okay, what are you doing? You're wasting your time. You're wasting your degree. This is not the way you should spend your life. You're just sleeping, sleeping, sleeping because of that GYN residency.
You were tortured. Yeah. You were scarred.
I know. And then I want to share one another incident. What happened? I was third year or fourth year medical student, and was walking in the hallway in front of lecture rooms. Remember those yellow doors? And
Yeah.
I was with Sylvia and Shala, and there were a group of people talking about USMLE. And I'm like, okay, Shala, what are they talking about? She said, this is some American exam, and they're nerds. They're just talking about that exam and going to America. I'm like, oh, thanks God, I'm not going to America. No, I'm not going to think about USMLE. And he said, never say never. I'm here, and I am thinking about doing USMLE. And I just like, oh my God, what did I say back then?
Oh wow, that's a good lesson. Yeah. Never say never. I've thought about that. Yeah. We tend to like, no, this is not our problem. So then you
And
thought about that, huh?
then my dad pushed me, and he was here for 6 months. Literally, he was forcing me every day, just like he forced me back then when I was, I didn't go to med school. So then I found some study partner online. I don't know what you guys did, but I found USMLE World,
Yeah, I did that too. Yeah.
yeah, so there were so many Indians I found online, and they were a very good friend of mine. Then we did a group study. I didn't go to Kaplan or anywhere else. I just sat home and studied. And I got good score first attempt. And then again, when it came to applying to different programs, I just behaved like I'm American grad because my husband said, make sure you apply close to Princeton, New Jersey. He was working from Bloomberg Financial Market. So he's like, I have office in Manhattan and then Princeton. So make sure you apply 45 miles of the radius. I'm like, yes, sir. Because nobody gave me any guidance that I have to apply, to as many programs as possible to maximize my chances of getting matched. So anyhow, I applied to just 25 programs. Can you imagine? Just 25.
Wow. People do 75 or 100
I know,
programs.
people,
Yeah.
250.
Yeah.
Then I got 8 interviews. So I was lucky back then, I think.
Yeah.
And I got matched first attempt, and I was like so blessed because I realized there were 6 or 7 people with me who did not get matched 6 or 7 years after I got matched. So,
my gosh. So where did you start your residency?
NUMC, National University Medical Center.
Yeah. Yeah. Okay. That's nice. That's beautiful. That's a very good program. I want to say if Ijaz went there too. I want to say. Sure.
I don't know.
No?
I don't
Okay.
remember, but there were a lot of RMCs. Asmatullah and Aisha. Aisha said.
Yeah.
She is our class fellow. She did residency there. After I finished, I think 6 months of my third year, she came to US.
Okay, very nice. So, how was it? How was the residency? How did
You
you?
know, it was a torture again, but not as bad as GYN in Holy Family.
Yeah, no, at least you were getting some paid.
Yeah.
So, but your husband was also at that time in that area?
So my husband was he moved from Princeton to Manhattan and Lexington, 59th
Yeah,
Street,
yeah. Okay, good, good.
45 miles from Nassau. And Nassau was giving us, on-campus residence. So that
Yeah,
was a plus. So
that's a
you
plus.
drive or anything, you were inside the campus and you're walking and going to the hospital. And then, yeah, so it was not as easy, but the system was so different. You did residency here. Like if you compare with the Pakistani system and here, American, totally different. And there's so many things and terminologies I learned with the passage of time. But first year of residency was, oh my God, unforgettable. I was doing telemetry rotation, and telemetry rotation is supposed to be very easy. So I started my day at 5 a.m. and believe it or not, I left at 12 midnight. And we were laughing at
Wow.
me because I was so new to the system and no help and nothing.
Yeah, I mean, honestly, I found that a lot of knowledge I was lacking, and I had to learn a lot. In the first year was not only that you have to do a lot of physical, but a lot of knowledge catching up, practical
Mm-hmm.
knowledge catching up, and then on communication skills. So that is a great lesson for us to actually learn as a nation to try to now keep up with our educational system and put us more into practical thinking. Because as medical students, we were just able to read and that's it. Uh,
Memorization,
yeah.
basically we were. Yeah.
So you decided to go into infectious diseases. Tell us a little bit about it. What made that decision?
Okay, so it's a long journey I want to share with you again. Okay, while I was 30 resident, I got pregnant. And towards end of my residency, with physical, mental stress, I was doing ICU rotation. I delivered prematurely, and then preemies, twins. So it
Hmm.
wasn't easy. My life was changed. I forgot for a while that I'm a physician. So those preemies were in NICU, though we were having excellent NICU team. LIJ, they were born in LIJ
LIJ, yeah.
hospital. So, but once I took them home, my real grill started. Both of my kids were colicky. Colicky, that premature
Yeah.
death, and they were just crying with pain all the time. And whenever they were taking their feed, they were having gas, and then they'll cry. And then both were opposite schedule. Like my son will be up all day crying, and my daughter will be up all night crying.
Another internship for you.
And then
Yeah.
maybe worse than
Maybe
internship.
worse than internship. Yeah, it's like, your
Yeah,
own
and
kids. Yeah.
my own kids, and then I begged my parents, I begged my in-laws, I hired a nanny. So you can imagine 4 people, one nanny, and then my husband. So we were all on our tiptoes, taking care of
Yeah.
2 preemies. And anyhow, and they quit eating at age of 3 months. That was another torture. They were crying with hunger. Whenever they were eating, they were having pain and they quit eating. So basically, then my mom did feed them with the spoon. Can you believe milk with the spoon?
Yeah, yeah, milk with the
Until
spoons.
age
They
of,
couldn't they couldn't suck because they were so weak.
yeah, because of no the gas and the
The
pain.
gas, yeah, yeah.
So I took them to so many physicians, so many pediatricians. Nobody was giving me any solution. So I just came out with my own solution of spoon feeding because there's no suctioning and they'll be
Yeah.
fine. So with the grace of God, 8 months, I was like out of that trauma. And I'm like, okay, I can breathe now. And I think I'm a physician. I have to go back to medicine. So another learning curve here, once I started applying to different state license, so they refused to give me license. They like, you did not touch any patient for at least 3 months.
Wow.
You are a big liability, so we are not comfortable giving you license. Then one of my friend told me you can apply for Michigan license. They're quite easy on the requirements. So I got Michigan license, and then I was in New York. My husband was having very good, stable job. So I had to move to Michigan just to pursue my career. I took my twins. I begged my parents, can you please come with me? And my mom is like, oh my God, I have no life. I can't go back home. I can't see my kids. I said, no, I started crying. I'm like, I'm not your daughter anymore. You're not helping me. I blackmailed her enough.
Yeah, cool.
Just she was willing to travel with me, and my in-laws were working full-time. They couldn't help me. So then I did locum hospitalist in a very small Michigan town, Fremont, couple of thousand population people. And so I was supervising 2 physician assistants. My job was quite boring because I wasn't doing anything except sitting in front of computer and signing their things and very little patient contact. I'm like, I have to be in a busy place because I'm gonna lose my skills. So then I applied to a busy hospital, Jackson, Michigan, W. Ford Hospital, and then I did locum 3 months, and then they offered me a permanent job, and then I signed a contract for permanent hospitals. So life was good again, like 7 on, 7 off. I was just traveling Michigan with my kids and my parents, and Harun was in New York. He was coming once a week. He was flying every week to see us. So it was torture for him because we wanted to settle down, but there was no point I could at this point. Like, no, I have to work more to see what I'm going to do. So anyhow, after 3 months being permanent hospitalist, I did not feel right. I'm like, what I'm doing, I'm dictating admission notes, discharge summaries, lots of dictations, and no thinking power. I'm just calling different consultants. What I'm doing, I'm just doing, work like clerk. I want to act like a physician, to think about cases, interesting cases. So I kind of liked ID while I was third-year resident because of one of my key mentor was infectious disease physician. And I was impressed with the depth of her knowledge, and she was doing her little detective work on all the complicated cases. But again, I wasn't very sure, should I go for this subspecialty or what should I do? So what happened, at that time I admitted one case that made my decision real easy. So I can share that case with you if you have time.
Yeah, I would love to, because that's usually a case a lot of people don't remember what made them come into a field. It's usually a patient or a mentor. So that's great. You have both.
Yeah, I have both. Okay. So there was a guy, 55-year-old Caucasian male, no past medical history, was having mild obesity, CPAP, he was using CPAP. And he was out in a restaurant having dinner with the family, choked on a piece of bone, started having respiratory distress, got intubated, taken to the small hospital, was having fever, leukocytosis. They thought aspiration pneumonia, so was given all kinds of antibiotics, did not get better, so got transferred to our hospital, which was a little bit bigger than this hospital. So I admitted the patient as a hospitalist, and then I saw white count 40,000 and fever of 105. Creatinine is going up, and he still cannot breathe on his own. So I called infectious disease council, and the team came and they added broad antifungal, broad spectrum. So then they ordered bronch, and BAL, and BAL came back positive for blastomyces. So,
oh, interesting.
And the guy died within 48 hours with multi-organ failure, septic shock. So very 50, 55 years, it's very young age.
Yeah.
So then I thought case is closed, right? So we all will think, okay, he died because of fungal infection, but infectious disease team came after the wife and got all the history, detailed history. And the wife told the guy favorite hobby was to make knives from deer antlers. Okay, so then that ID team asked the wife to bring knives and deer antlers to the hospital. They took them to the lab, and the lab workup showed that they were full of blastomyces.
Oh
So he
my God. So he inhaled that while he was working.
sports and gave the sports and with good immune system. It wasn't like he was on steroids, biologics, and immunosuppressants. So that case was quite interesting for me and fascinating, and pushed me more towards ID. And I'm like, I want to be a smart person.
You will be my best friend, because as a rheumatologist, whenever
Yeah,
patients are coming to me, I'm always like, okay, before I give it to start them on any biologic therapy
I
or
love
DMARDs,
this.
I hope it's not an infection. And if an infection signs off on infectious diseases signs off a case, it's always like a
You're
blessing. Okay,
comfortable.
good. Thanks God. So you save not only patients' life but doctors' lives too.
Doctors like you. Yeah, so that was quite, interesting.
Oh, that's
Oh my God.
that is a great case to share. I would have, I have to tell you that these are unique cases that you can learn if you keep your eyes open, and they're motivational. So let's talk about that journey then. So infection disease was kind of your calling, and then you became
Yeah.
a fellow. Where did you start your fellowship?
Okay, so luckily, with the grace of God, I got pre-match SUNY upstate, the same place where Haris is working right now.
Is there? Yeah. Okay.
Haris Mubin, our class fellow. So Haris met me even way back, 2002 or three, when he was just exploring more for residency, and he stayed with me one night. So I still
Interesting. Okay.
he
Good.
was so confused at that time. He's like, I don't know what I'm going to do. I don't know where I'm heading. I have no place to live. I offered him a place. I said, you can live here. No, no, no. I have so many friends to catch up. And I still remember. So
Oh,
then we met. He invited me on his wedding. So I went all the way to upstate New York to attend his wedding. I was the only class
wow,
fellow.
you're such a good friend. I remember him mentioning about it. Now I think about it. I think he was living with Farhan, where I lived with them for, I
Yeah,
think,
North Dakota or
North
some kind
Dakota.
of.
Yeah,
Yeah.
yeah. It was a crazy time. My gosh. Okay. What a struggle.
Yes.
As
What
a,
a
a
struggle.
as a man, we always think, oh, we go through hard times, but you know, women are more stronger, so they don't complain that much about. But your journey is very inspiring, going
Totally
through
different track of struggle.
different track of struggle and responsibility. So SUNY upstate, right?
Sydney
Syracuse.
upstate, Syracuse upstate.
Syracuse. That's a cold place. Okay. So
Oh
then
my
you,
God. Yes.
yeah, and then you ended up, when did you come to Texas?
Okay, so I did first 3 months of my fellowship. Again, I can compare with as a hospitalist, working as a hospitalist, 7 on, 7 off, getting big paycheck,
Yeah.
very stable job, salary, and health benefits. But now I'm interning, maybe internship. SUNY Upstate is a very busy place. It's like more than 800 bed hospital, and then you have to cover 250 bed hospital, which is just right next to it, Kraus private. And then you have to cover VA, which is 200 bed hospital. As a fellow, you have to round all these three places. And there were only three fellows. And the daily patient census 50 to 55 for one
Oh,
person. You
for
can
one
imagine. So
person?
I'm like, what did I do? Why did I come to this
You should
place?
have taken rheumatology. When it's 10
I
patients, we
know.
we start
I know.
complaining about it.
I know this was crazy, and I never expected IDs that busy.
It's, yeah, it's very busy.
I'm not getting that big paycheck, and I'm seeing so many patients. So should I go back to hospital? I was so double-minded 3 months. I was dragging myself, working from 5 a.m. again 11 p.m. So I'm like, okay. Then one night, and plus preemies were with me, right? They were like 2.5 or 2 years old, and my husband was in Manhattan, and I was renting an apartment all by myself with my parents. Again, I begged them to stay with me. So anyhow, 3 months, I was like, I told my program director, Tim Mandy, great person to work with. He's a virologist. I'm still impressed and influenced by his all achievements. And So he gave me so much confidence and everything that I can do it. 3 months, I said, okay, Dr. Andy, I'm leaving. I'm quitting. So he's like, wait a second. He closed the door, he sat with me, and I was having tears in my eyes. I said, my kids are getting sick. I have one leg in the hospital, children's hospital, one leg, rotation. You guys are so busy. He's like, okay, do you like ID or not? Just say yes or no. I said, I love ID. He said, okay, just leave everything up to me. He was such a great person, and he is a great person. He's like, you don't find people like him who can force you or push you to finish your task. So he's like, it's okay if you will finish it 2 months, 3 months after, your the fellowship time. So I'll help you. Anything you think is going to make your life easy in this rotation or in this fellowship, I'll help you. So I can see potential in you. You can do it. So I'm like, thank you so much. So he made my day and gave me so much confidence that I can do it. And then there was in-service exam, and I was number one in in-service exam after 6 months. And every 6 months, my rank was on the top. And he's like, you should go to transplant ID fellowship. I said, please forgive me. He's like, no, I have a friend in Pittsburgh, and they're begging for a good candidate, and you are the best candidate for transplant ID fellowship. I'm like, okay, let me think. Then I discussed with my husband, and I'm like, oh no, we need to settle down. Then I have to go to Pittsburgh another year away from my, husband. And then the biggest thing was, once you have a super specialty, then you have to be in a bigger cities with, academic centers. You cannot go into small towns. And we were so sick of living in bigger places, like so much time waste in commuting and no time for family. We're stuck in traffic, especially, Long Island, New York, Pennsylvania. There's pathways, and you are just like on parkways. You're stuck bumper to bumper traffic. And my husband said, no, we have to settle down somewhere. So I'm like, okay, I cannot do transplant ID. So I just told him I'm sorry. So basically.
Wow. I mean, I think that at some point you have to kind of put your foot down somewhere. And so that moment you decided that ID, general infection disease, is a specialty which is very much needed in most part of the world, right? And in America, I mean, no hospital can run without an infection disease specialist. So you're still very valuable. You were by then, were your kids getting a little bit better health wise, and you guys then?
Yeah, that was the best time of life with the kids, because they
Yeah.
started talking, they started asking again. My son was having speech problem.
Yeah.
And I was having speech therapy and all,
But most of the kids who are bilingual, they're slow. My kids is like that too. So they get confused in what language to pick. So so when did you guys move then? What was your next move for career job, like as in employment versus?
Yes, yeah. So what happened, we were looking for someplace warmer than New York, because we were shoveling snow all the time and slipping, skidding and falling down. Like, okay, we're done with snow area. We have to pick some warm areas. So I applied in Florida and Texas. So I ended up in this small town because I did not want to practice in big town. And then again, guidance against hospital employee being a private versus private practice, no guidance at all. I just took my chances. I came here first as a hospital employee, and I really liked it. Basically, I was having guaranteed salary, good health benefits, and patient load was not even close to whatever I was seeing over there.
Yeah.
50 patients a day. Here, hardly 10 or 15 patients, and anyhow, so after 6 to 9, I think 9 months, again, something was inside me. No, I'm not happy. There's something different I have to do. Maybe I can try private practice. So again, difference between you guys and as females, we don't have to be the sole breadwinner. So my husband was having a stable job, so I could take a chance of not having paycheck every month, and I can
build your practice because it
Yeah,
takes
build my practice.
capital, it
That's,
takes
mhm.
time and money. And so I'm glad you did what you did, because a lot of times people are like comfortable with being
Whatever they
just,
do.
yeah,
Yeah,
whatever.
yeah,
Okay.
and you know, for home in America, we do get training how to see patients, how to improve your communication skills, bedside manners, but nobody teach you how to bill, code, and how to go for reimbursements. So that's a technical part as a private practitioner because you have to learn those things to be successful. I'm not saying money is everything, but it is something that you have to, you know,
Of course you have to, like, pay your bills
yeah.
and feed your family, or so
Yeah.
so
So
tell
then,
us a little bit about that. How did you start your
yeah.
practice?
So after, as I said, 9 months, there was a private practitioner here in this town, Dr. Robert McBroom. I respect him a lot. He's a good advisor. So he was running his private practice in infectious disease for more than 20 years. And he said, why don't you join me? I said, I did not even understand the meaning of, joining him, what I'm supposed to do. No guidance whatsoever. I'm like, okay, what I'm supposed to do is like, you can see patient and leave everything up to me and I can pay. I say, it's the same thing as hospital is doing. So I have to do something different. He's like, okay, do see your own patient and do your own billing, and I'll see my patient, I'll do my own billing, and we'll share the cost of the overhead office, like nursing staff or office manager, 50%. I said, yeah, that sounds right. I can do that. He said, you can try 3 months. If you don't like, you can join me as 100%, like I will take care of you. I'm like, okay, no, I will do my own thing because I wanted to do something which is, unique to myself rather than asking for other people to help me. So then I started going to LTAC. I was having no patient base, right? So I went to LTAC, nursing homes, and small towns here, like satellite clinic. I opened small satellite clinic. And after 6 months, I worked hard though. I did not realize because I was so happy doing something for myself. After 6 months, I got so many patients that I got, overwhelmed. I'm like, okay, I don't want to go to different places. Now I will have one base here in Wichita Falls and people can come to me if they need me. So again, with the grace of God, I got so busy, I can't tell you.
Oh, wow. This is so, it's an enterprising personality that comes out of this situation. I have to tell you that as a person who's educated in medicine and not knowing business, all of this is a learning curve, right?
Oh yeah.
Credentialing with insurance companies, renting
Mm-hmm.
spaces, dealing
Mm-hmm.
with paychecks, creating your own malpractice insurance,
Mm-hmm.
and everything is so hard and
Yes.
complicated in America administratively.
Yes,
So
it's a risk. I took it, and God
and
help.
and then you were going to other institutions. You have to get credentialed at other places,
Mm-hmm. Privileges and
traveling. Um, but you were a hard worker and you were a good physician. So you got busy quickly. That's amazing. It takes usually 3 years for most physicians to get busy and be able to sustain themselves.
thank you so much.
So, so tell me a little bit about current situation now. Are you still in that practice with?
So I'm still in this practice. It's don't get me wrong. I'm not saying I wasn't happy as a hospital employee. United Regional is a great hospital, and I do respect every single person there. Administration is very good and friendly. So the only thing, and they were not micromanaging me or anything, but again, it was me wanted something different.
Yeah,
So as a private practitioner, I think I'm more relaxed, I'm more flexible. I can create my own schedule. Like, let's say if I don't want to work Friday, so I'll see Friday patient, Thursday I'll be more busier. I won't see less patient, but I'll see more a day before so that Friday I can keep, free for my kids or my family commitment if I need to. And usually I don't work Fridays because we go to mosque and those things and do all.
good, very nice. So now tell us a little bit about the the story of getting stronger through your difficulty and challenges in life are very obvious. How is currently the life in Texas as a Pakistani working woman and within a community where there's a lot of Desi people? What is it like being here?
So this is very small community, just 100,000 population, and it's away from Dallas, which is a big hub for Pakistani community. And I was very reluctant when I came here because mostly, different kind of town.
Yeah.
But they welcomed me that I wasn't expecting that kind of behavior or attitude from them. And I hardly hear any patient is unhappy, and they're very what you call genuine, honest, and I feel so happy and contented when I help them and getting them out of their misery. And they send me small notes, appreciation notes. Thank you so much, Dr. Nagra, for saving my life, for this and that. I'm like, I don't.
Wow, that's beautiful. I
Yeah.
I have to tell you, Ghazala, you have to share with us your office information, your website, and this is a this. I'm glad that we talked about it, um, because it's not very common story to go through struggles and choosing to have a harder life, but eventually becoming your own boss and being able to control your decision. That's the ultimate goal of most physicians. But unfortunately, many hundreds of thousands of physicians in America are losing their independence and becoming employees of big
Mhm.
corporations. You staying independent and being able to practice and being happy is
Yeah.
in itself is a blessing of God. So I'm so happy to hear that from you. Is there any life advice you want to share with all of us and to that could help us?
Yeah, so my biggest advice to any physician, young physician, be persistent, work hard, do not lose hope, and keep faith in God. Because hard work never goes waste. That's what my practical experience.
Yeah.
There is a will, there is a way. So you can achieve something you have not even dreamed about. So with the hard work.
Thank you
And
so much. Uh, I would ask you that this is, if it doesn't help us right away, it will help any viewer who is maybe 5 years behind us, and they would see you and they would say, this all of this is actually a result of hard work because there was no planning or there was no strict guidance.
no
But
guidance.
you made your own path, and God has rewarded you with success, and I hope you continue to do well and stay happy and healthy. Thank you so much for your time.
You're
Uh,
welcome.
and I
Okay.
would like to talk to you a little bit about COVID, but in a separate video. So just don't don't go away yet. Okay. Thank you.
Okay.
All right.
Thank you so much. Thank you.
All right.